Okay, for our final section of bladder points, we're going to be covering bladder 25, 27 and 8, bladder 54, and then bladder 60. So starting off with bladder 25, this is going to be lateral to the caudal border of the spinous process of L5, also between those more medial muscles, the longissimus and iliocostalis. So we knew that bladder 23 was just caudal to L2. So we can kind of imagine L3, L4, L5 in terms of that region. Again, it would be useful to be able to feel the vertebrae, but because this guy doesn't really have any, we can just approximate based on the spacing above. So there's going to be bladder 25. Bladder 27 and 28 are going to be respectively in the first and the second dorsal sacral foramina. Between the border of the medial border of the cranial iliac spine and the midline of the sacrum. So one way of doing that is going from the sacro-coccygeal junction where the tail would start moving and working forward until, say, we fell into the divot that's the lumbosacral junction, or we could work backwards from L5, L6, L7, that's kind of where our lumbosacral junction is going to be, and then just caudal to that, we would be going into bladder 27, bladder 28, aiming to go lateral to the actual sacral foramina. And so here I would sort of be imagining, we've got some winny bones in there, imagining that the dorsal or the medial aspect of the cranial iliac crest would be around here on each side. This is sacral midline, so in between those two regions, sort of bisecting it, is where those bladder 27, 28 points are going to be. For bladder 54, one of the points in the hip triad, we would want to be using flat hand palpation to identify the greater trochanter of the femur. It would feel about grape size, probably smaller in this guy. I can feel one of the bumps here, which we could assume for this exercise is the greater trochanter. Just dorsal to that is where bladder 54 is going to be placed. So we'll imagine this bump to be the greater trochanter. Just dorsal is going to be that bladder 54 point. The last one's bladder 60. So similar to and opposite to where our kidney 6 point is. Let me check. Kidney 3 point, pardon me. I was thinking spleen 6, kidney 3. So similarly, on the lateral malleolus of the tarsus, we would want to be going just proximal and in between the region created between the lateral malleolus and the calcaneal tendon, which would be running up here. So about right there. And that completes the big points for the bladder channel.